homework, and I'm talking about it a little earlier in the call than normal, about 5 minutes earlier than I normally would, because I want to make a little side trip to talk to you about a meeting that we asked everybody to think about scheduling here in the next couple of weeks, because it's an important part of the implementation process. So you can see here, bolded in the yellow, hold the meeting that you scheduled at the beginning of the call series with as many surgical personnel as you can to come to it. And that would include, if you possibly can, surgeons, nurses, surgical technicians, anesthesiologists, nurse anesthetists. Anybody who works in the operating room who needs to hear about this should be invited to the meeting. It's best to hold it in a place that's big enough to accommodate that size of a group for your hospital, and it's best to try and put it at a time when the most people who you possibly can have at the meeting could come to the meeting. You may want to do the meeting more than once to touch as many people as you possibly can. And I want to talk just a little bit now about the meeting. First, we've created some materials for the large meeting that are going to be available on the South Carolina portion of the website. So there's going to be a presentation template that you can use to create your own PowerPoint presentation that you could give to this group. If you don't like it, do your own. Or if you like it and you want to steal from it, please feel free. There is a document that goes with the PowerPoint presentation that explains every single slide and how it's meant to be modified. So there are slides. If you gave the PowerPoint that's up there and didn't change it, it wouldn't work, because it's asking you to modify it for your own specific hospital, to put in a copy of your own checklist, to use your own video if you already have one by now as part of the presentation. Those two pieces, the template and the document that talks about the template, the presentation guide, can help you create the content for this meeting. And the ideas that are captured in the meeting are ones that are taken from the experiences of literally hundreds of other places that have done similar introductions to their OR staff. Both those things will be available on the Safe Surgery 2015 website in the South Carolina webinar section later this afternoon. Okay. We'll email a copy too? Okay. So we'll email you a copy of the presentation and of the document. So here's what the large meeting is all about, and how we would suggest, or I would suggest, that you structure it. Start the meeting off by grounding people and helping them understand that the kind of things that the checklist is meant to help with, that the checklist is meant to stop, could happen at your hospital, even if they never have happened at your hospital. The presentation that's available or going to be available on the website this afternoon has a story in it that you can feel free to use. It makes a point about how important conversation and communication and also following process and procedure are to avoid a very bad outcome for a patient. None of us are immune, and that story needs to send that message to the group that you're talking to. So you want to start them out by orienting them. We're doing work in a place where this could happen to us. As good as we are, it could still happen to us, and something like the checklist can decrease the chance of something bad happening in our hospital to one of the people, one of the patients, who we are trying to help. And that is the worst thing that we can do in healthcare. Set out to help a patient and end up hurting a patient. So start with a story. Then you can share with the group, be it all physicians, all nurses, all anesthesiologists, all surgeons, all surgical technicians, with some of the data. Because the data from the initial pilot study And some of the other studies that have now been done around the use of checklists in the operating room is very compelling. At a minimum, it says that something like the checklist doesn't hurt. And the evidence that we've collected so far from a bunch of different places says that it helps and that it can help improve the outcome for our patients in significant ways. So tell a story, share the data. And then, if you can possibly do it, show them an example of what it looks like for a team to use the checklist. Now, the very best example is using a checklist from your own institution, with your own people running your own checklist. But if you can't do that, and you want to hold the meeting, there are a bunch of videos on our website, and there are even more videos available on YouTube that can be downloaded and inserted into a presentation so you can show people what it looks like. If you just show them a piece of paper, a lot of times that's not enough. That's why we want you to make your own video. When you have this meeting, you want to show people what it actually looks like. Now, there is one other way to do that. It doesn't take video, and it doesn't take a computer, and it doesn't take anything. You can prearrange to have a small group of people come up in front of your meeting, assume roles, and run the checklist. Just like Beth and I did the last 2 weeks in a row to show you how to have conversations, and in the week before that to show you how to actually run the checklist. You can do a similar, you can call it a simulation or role playing or whatever, but you can show people how to do it. So we want to share a story about why. We want to show them the data about why, and then we want to show them how they're actually going to do it. Because by doing that in a group, we're sending them a powerful message, and we're answering a lot of their questions about what it's like to actually do the checklist. Again, because you can look at it on a piece of paper, and it's not alive, it doesn't have the voice of people, and you really can't conceive of what it would be like to actually do it. And then tell them the plan that you're going to use to bring it into their operating rooms. So this big meeting has a number of purposes. If you follow the PowerPoint template, it'll basically do all these things for you. If you want to do it on your own, that's fine too, but just make sure that you cover these big things. Engage the folks and make sure that they understand why this is important in your hospital. Share the data that shows that it works, and it's worked in other places. Show them some kind of an example through role play or video, and then tell them the plan that you're going to use to bring it to their OR. So when they leave that meeting, they have a really good mental picture of what you're about to ask them to do.